Good afternoon, everyone. Buenas tardes a todos. And thank you for joining St. Augustine's lecture series. It is my great pleasure to introduce a St. Augustine graduate, a person who has dedicated his life to serving others with a unique path and inspiring story, Lieutenant Galvan. Thank you for joining us today.
Thank you so much for having me. I'm very, very appreciative of the opportunity to be here.
Thank you. We have a very interesting topic for today. Diversity in healthcare saves lives. But before we dive into the topic, we want to start by hearing Lieutenant Galvan's story, because it's our own stories that serve to inspire others. It's what shows that anything is possible with a lot of hard work. So, Lieutenant Galvan, the floor is all yours. Please share with us how this journey begins.
Well, first of all, I just want to say thank you to everybody that's here listening to this lecture. I really appreciate the support. Gracias a todas las personas que están aquí dándome soporte y escuchando esta lectura que yo voy a dar hoy. Es un verdadero placer. It's a real pleasure. And thank you so much to St. Augustine College for having me here. Well, my journey started in San Juan de la Maguana in Dominican Republic, where I was born and raised. Then I migrated to the United States in 2003, having very little dominance of the English language and not really knowing what I wanted to do. I started going to St. Augustine College that same year. That same fall, I started going to St. Augustine College. And that's where everything really began. St. Augustine gave me the opportunity to learn the language, to be able to speak it more fluently, to be able to know basics of history, basics of biology. And so my interest in being educated and being able to be better prepared to have a brighter future really began. And one of the reasons why I feel so humble to be here today is because this is where it all started in St. Augustine College. When I finished St. Augustine College, I became a medical assistant. And that was my first exposure to healthcare. As a medical assistant, I was working with a lot of nurses, and that's where I saw the compassion that it's required. I saw the hard work that is necessary and the level of preparation that it's required to be a nurse. Being a nurse in the United States is vastly different than it is in the Dominican Republic. In the Dominican Republic, is not a job that is very sought after, and it's something that maybe one day I'll work to try to change. And so working with nurses allowed me, I saw it firsthand, everything that they did for their patients. And so I got inspired and I decided to go back to nursing school. And so I went and started working, I started working on my nursing career. I went to Wilbur Wright College, which is one of the city colleges of Chicago, and I got my LPN license. Interestingly enough, because I was already a medical assistant and I had an LPN license, I was recruited to be a nurse, a medical assistant instructor, which is where my teaching experience began. I started teaching medical assistant very early in my career, so that I got exposed at what it was like to teach others and to create more, foster that knowledge and pass down all that training and information to other people. And I got enamored. I just fell in love with doing that. I got my associate's degree in nursing in the city colleges of Chicago. And then I went to Northern Illinois University to get my bachelor's in nursing. From Northern Illinois University, I went to Chamberlain College of Nursing, and I got my master's degree in nursing education. Because of what I mentioned before, I fell in love with academia, and I really wanted to have a bigger impact in nursing. And I thought that educating the future nurses was probably one of the most impactful things that I can do. After I got my master's in nursing, early on in my career, if I can step back for 1 second, as soon as I became a nurse, I started working in the psychiatric field. I became an inpatient psychiatric nurse. My first job was with adolescents and teenagers. Adolescents and young children. as young as 4 years old.
Mm.
And that's when I also started learning about a field that I was not very aware of. Psychiatry in my country, it's something that's very lackluster, and it's something that definitely needs a lot of improvement. And so I didn't really have a lot of exposure where I came from in psychiatry. That is something that I also fell in love with. Teaching in psychiatry became my two new loves. Ever since then, I've been working in an educating and or psychiatric um, field for the since 2010 when I first graduated as a nurse. I've worked in many different roles. I started as an inpatient psychiatric nurse. I became a inpatient psychiatric nurse educator. I also became a dean of nursing from the same institution that provided me a scholarship to be a nurse in Carreras en Salud. And if she's here, I just want to say thank you so much to Ines Montero, which was one of my mentors in that program. Then I left to California to be the manager at an inpatient psychiatric unit um, in the VA. All throughout this, I've been working with veterans in many different forms and fashions. And so another thing that I became passionate with was the veteran population. So I wanted to serve my country in a way that I felt that it was giving back. And so I joined the military in 2014 as in the nurse corps for the Navy Reserves, which I started as an ensign, and then I escalated, and I got promoted all the way to a lieutenant, which is what I'm standing now. Recently, I transferred to the Air Force. The Air Force has given me a scholarship so that I can finish my doctoral degree in nursing with a concentration in uh, psychiatric nurse practitioner. So by this December, I will be doctorally prepared, and I will be a inpatient. I'm sorry, I'll be a psychiatric nurse practitioner, and so I will be able to, even give even more that I could in the past as a provider now, being able to diagnose and prescribe medication and help my community.
That's wonderful. That's quite a journey you've had there. So when you were talking about starting off as starting at St. Augustine and just pushing, how did first I want to know, how did you get to St. Augustine? What was that push? And not really of St. Augustine, but just in general, what was that push to start your education?
Well, there was two people that were very influential in that process, and the first one was my father. My father came to the United States, um, trying to give us a better opportunity, better odds to his kids for us to be able to just do something with our lives and be productive members of society. So he was always influencing me with education. As far as being specifically going to St. Augustine College, I thanked my brother a whole lot. My brother was already a student of St. Augustine College, and as a matter of fact, he is a graduate from St. Augustine College as well. He's a person that I look up to, and I was just trying to follow his steps.
The influence of family, right? It's incredible. We have, yeah, a lot of stories like that at the college.
He's kind
And
of the trailblazer of education here in the United States, and I was just following his path.
That's wonderful. That's very inspiring. Do you think that along the way, and I think you and I briefly spoke about this at some point, you had a lot of people, and it seems a lot of, well, a lot of people that influenced you at certain points in your life that gave you this chance to move from one direction to the other, and then different jobs. Can you talk a little bit about that journey?
Oh my God, absolutely. I can't even tell you exactly who those people are. I remember when I was in St. Augustine College, I remember one of my teachers, and I think he became a president of the college as well, Andrew's son.
Yeah, he was the
He was
past
one,
president.
yeah, he was one of my inspirations. He was very um, amicable, very approachable. He inspired me to just seek out more and more information. When I was in City Colleges of Chicago, like I said, Miss Montero is also, she's of Hispanic descent. She really pushed it into me to, be better, to go after big dreams that do not settle for just getting a good paying job, but to try to help, just to try to do more for your community. When I got hired as a dean of nursing for Instituto del Progreso, it was Dr. Lau who gave me that opportunity to be able to step into that position. When I was teaching full time for Dominican University, one of the best leaders, one of the best one of the best people in my life professionally, Kristen Bayer, was an amazing mentor to me. She also inspired me to just continue to seek out better opportunities to educate myself and to give back to the community. When I went to the VA, Sean Miner was uh, one of my mentors. He was one of the people that inspired me to go into the military. And Push Pinder Tour was one of the people that hired me as a nurse manager when I was working for the VA. Theodora Banks also, I really want to mention her. She was the first one to open the door for me to get into the VA. But overall, the people that I really have to thank, I have to thank my father for in just being that rock, being that inspiration, being that the person that really taught me about the importance of education. And also very importantly, my wife, she's been very supportive. My wife is, I wouldn't be able to do it, the things that I've been able to do without her support. And it's just a collective effort. People see me where I am today, but they probably do not see all the different hands that had that had a little bit to do with my journey. And that's one of the things that I try to stay focused with, so that I can utilize that to give back and be part of somebody else's journey as well.
That's beautiful. And I think you say it right, a collective journey, right? Because it's a collective effort. And I think that that's very important for our community and our students to know that it's not just one person, right? You have to ask for help. You have to be willing for people to help you step up, right? And go one step at a time and further and help you push you, right? Because I sometimes feel that as people, we think we have to do it on our own, but it's not really how it works. Would you agree with that?
Absolutely. One of the things that I teach my students is I'm not going to be able to help you unless I know what the issues are. I've had a lot of difficult conversations with students that were not related to school, and I was able to give some sort of guidance or provide some sort of resources that they at the time didn't even see themselves. And so being able to communicate with one another, being able to reach out with one another, and understanding that we don't do it alone. I wouldn't be able to be a nurse. I wouldn't be able to be in the military. I wouldn't be able to be a manager. I wouldn't be able to be a teacher if it was not for people that trusted me, if it was not for people that guided me, and and if it was not because of people that gave me the confidence to be able to just go for the things that I really thought were important to me.
Yeah, and I think that's why you continue, right? And I love that you give back. Rich, everything you've been doing, you're giving back, and that's wonderful. So I want to move us a little to our topic for today, and this is really your topic, right? Chosen by you. Yeah, so diversity in healthcare saves lives. So
Yes.
tell us a little bit about this. What are your thoughts behind this?
So diversity in healthcare saves lives comes from the fact that now we know how um, the diversity of the healthcare people that work in hospitals and the different settings of healthcare, how does that affect the outcomes that our patients experience? So we now know that whenever we have a population that is diverse, a healthcare system that is just as diverse, it's likelier to have better health outcomes. Those things can be things like vaccination rates. This is a very important topic, especially now. The research that I have is from about 5 years ago, but it's very relevant today when he talks about that in communities, the number one thing that makes people want to get vaccinated is when their community themselves are the one doing the outreach, not not politicians, big um, not big chains pharmacies, but the people talking to the people. I can give you a very the best example that I can give you is myself. When this whole pandemic started, a lot of my family members reached out to me to ask me questions. What do you think about the vaccine? What do you think we should do? How do you think we should behave? Right? There's so much misinformation, but they know that I have their best interest at heart. And that's really what matters. When you know that someone has your best interest at heart, whatever you say, they don't have to go in there and look it up. And so I took that very seriously, and I did a whole lot of research in regards to our situation, our current situation, and I felt confident to advise them on what to do specifically, to go ahead and get vaccinated, to go ahead and take those precautions that can keep them safe and that can keep their communities safe. What do we mean that diversity saves lives? Well, the fact is that there is a decrease in hospitalizations from chronic illnesses when the diversity of the healthcare workers matches the diversity of their communities. The least hospitalizations from chronic illnesses, the lower the mortality rates among people with chronic illnesses. And this is significantly substantial. We're talking about things about diabetes, hypertension, which are things that closely affect our community. We have propensities in our healthcare community, in our Hispanic community, our Black communities, and our Asian communities are very likely to experience these types of chronic illnesses. And so if we have a healthcare force that matches that level of diversity that our community every day is advancing, then we know that we're going to save lives because people are going to be going to their appointments. People are going to be, they're going to have someone that can understand them, They're going to have someone that can sympathize and empathize with their culture. And ultimately, it's going to save lives.
Yeah. And I think it could be applied to many aspects, right? And going back to education, how having that language, the language barrier will affect. But in healthcare, do you think currently there's like a lack of diversity at this moment? Would you think there is? Or do you think it's in some way it's been changing throughout the years, and especially now, given the past, given the pandemic, do you think that in any way this is changing or will change?
So we're definitely, and in the healthcare field, we're definitely becoming more diverse. It's just not happening quick enough. It's not happening fast enough to keep up with the rate of diversity that our communities are experiencing. In nursing, for example, it is still a vast majority of nurses are still Caucasians and whites. And it's not that Caucasians are not competent. It's just that that lack of diversity does have an effect. Oftentimes, if you have a patient that doesn't speak if you have a nurse that doesn't speak your language and you are doing a psychiatric evaluation, there's going to be a lot of things that that patient is not going to want to talk about with a translator. They want to make that connection with their provider. And that's something that it definitely has a significant impact. I think I shared this story with you very close to my family. There's been situations where there's a family member is in need of mental health, which is so important, right? They're needing mental health, but they don't reach out to any mental health providers because none of the options are mental health providers that speak their languages. And I remember offering, hey, I'll go with you and I'll translate. And they would say, I don't feel comfortable, regardless of how close you are to me. I want to make that connection. And they went untreated and undiagnosed for many years just because they couldn't find someone that they can empathize and make a connection with. And so this is continuously happening. It's not happening fast enough, especially in rural areas. San Augustine College is in a metropolitan area. It's a big hub where there's a lot of diversity, where there's a lot of different communities that clash. But when you go to smaller cities, when you go to the rural America, it is for the most part a very homogeneous type of people that are working in healthcare.
Wow. What do you think we have to do as a community to change that?
Well, I can tell you what helped me become part of the healthcare world, right? There's a lot of challenges that we have as what do we call? I did a paper about this where we talk about the non-traditional students. What are some of the challenges of non-traditional students? What do we call non-traditional students? Are students that have families, they already have kids, they already have jobs. They're not the 18 to 23-year-old that's living with mom. They have a lot of responsibilities. And so there's a lot of support that needs to happen in order for them to be able to get into these healthcare programs. When I was the dean of Instituto del Progreso, the dean of nursing, one of the things that I worked really hard to do was I was trying to build that bridge from the underserved communities to being in the program. It's a big stretch. You think that anyone can just come in and say, hey, I want to be a nurse, I want to study nursing, but it's a lot more than that. They need to do prereqs, which sometimes can take a year or two, depending on how many classes they need to take. And those prereqs are usually given in community colleges or private universities at a regular time in the morning. Very seldomly they have classes that can be in the evening, right? And so those are some of the things that we need to look at. We need to build that bridge of resources. We were trying to have a daycare within the college so that when you don't have the excuse, not the excuse, you don't have that barrier of not going to school because you don't have childcare, right? So
Right.
removing all of those barriers and making it more likely for people want to better themselves. People have talents, but they also have priorities. I need to feed my family. I need to make sure that my family is safe. I can't just leave my kid, in a stranger's home. We need to be able to look within and assess our communities and provide those opportunities and remove those barriers so that more people can come into the career and better themselves. It was extremely difficult for me having to drive all the way to DeKalb to Northern Illinois University while also having a newborn. And this is why I said that if it wasn't because of my wife, I probably wouldn't be here because she was the one behind me, supporting me, taking care of my kid, and doing all the things that I needed to remove some of those barriers. But sometimes it's a lot more difficult than that. And we as educators should probably work on just making it easier, helping those non-traditional students with whatever it is that they need.
Yeah, and it's great that you say that. That's really the basis of St. Augustine, right? St. Augustine caters, and we know we've changed a lot of things within the system as well, just to make sure that we can provide access to education. Because it's one thing or another, like you said, it's families, or it can be access to the internet, resources, all these different types of things. And I'm happy to know that we're currently doing that at the college to make sure there's it's up to really then going to be up to the student to want to thrive because all these things are being given to them and the support is there, which sounds like you had a great team of support in one way or another.
Absolutely. Yes,
Yeah.
and I've seen it in St. Augustine College. I remember when I was going to St. Augustine College how a lot of the times they have the different campuses to accommodate geographically for you not to have to go to different places. That helped me a lot. I remember I used to go mostly to the Armitage campus. That's where I took most of my classes. I wouldn't be able to go to the main campus because it was just difficult for me. I didn't have the means necessary. And so St. Augustine was able to provide not just geographical resources, but also financial resources. There was things like if you get your GPA was at a certain point, they'll be able to give you some additional help towards your tuition. I mean, yeah, St. Augustine is a great example. Do I think that St. Augustine can do more? Absolutely. Is St. Augustine doing a lot? Absolutely as well. Those two things can coexist.
Yeah, absolutely. We can always do more and do better with
Absolutely.
anything, right? Yeah, absolutely. And you also mentioned that you teach.
Mhm.
What is it that you currently teach?
So right now I teach mental health nursing and community health nursing. Those are my two babies. But I've taught all the a gamut of classes within nursing. So I've taught everything from fundamentals, pharmacology. I've done some of the clinical classes where I go to the hospitals with the nurses and I teach them how to do specific skills like starting IVs, giving shots, listening to somebody's lungs, operating some of the machinery that we use in hospitals. So I've done quite a bit of an eclectic background when it comes to um, education.
That's great. You mentioned mental health, and that sticks a lot in my mind because I feel like sometimes it's very taboo within our community, right, to speak about mental health or to even want to seek help. How do you think having diversity within the mental health industry will help us?
Oh, that's an awesome question. I am so glad you asked me that, because I would have been upset at myself if I didn't talk a little bit about this. The main thing that we need to remember with mental health is that until we are able to remove the stigma, it's going to be difficult for people to get the help that they need. I'll give you the example of someone that has diabetes. Someone that has diabetes, they go to the doctor, and somebody asks them, "Hey, what did they diagnose you with?" "Oh, diabetes," and no one's bats an eye. It's just normal. It's just a chronic illness, and there's no negative stigma surrounding it. But if you go to the doctor because the most common type of mental health illness is anxiety worldwide. Depression is the most common in the United States, but anxiety is the most common mental health condition. If they say, "Hey, they diagnosed me with generalized anxiety disorder, and I'm going to be taking some medications for mental health, and I'm going to be doing therapy," just think about the reaction of the general public. How would people normally welcome that information? How supportive are they about it? What is the depiction in the movies about people that have anxiety disorders? What is the depiction in history, right? So the stigma behind mental health continues to be significantly negative, and so people are very hesitant to even admit that they have an issue. An issue is not an issue until you say it is an issue, right? If you don't take that first step to get help, you're not going to be able to overcome that. One of the most common misconceptions about mental health is that it's just something that you can just shake off. The truth of the matter is that in the brain, just like everywhere else in the body, there's specific chemicals that if those chemicals are not well balanced, well, the person may have difficulties and they may have specific conditions, right? We know that with depression, for example, there's a specific chemical called serotonin. When serotonin is not at the right level in the right places of the brain, it is very difficult for someone to experience pleasure. It's not something that you just can turn on or off. So having depression is not a weakness. It's not a character fault. It's just something that can happen to anyone. Like it can be any kind of chronic illness. And so it should be treated like that. We should be able to talk about it. We should be able to reach out to people that maybe experiences this kind of disorders and not look at it in a negative view. But it really starts with our communities, making sure that we know it's okay. If you feel depressed, it's okay. If you feel anxious, it's okay. If you're hearing voices, absolutely, please reach out. It's okay. Especially nowadays, there's the populations I serve, which are mostly veterans. They have the highest rate of suicide, and that's usually that's 100% preventable. Suicide is a specific state of mind where the patient experiences hopelessness, and at that point in time, they may see the solution as just ending their lives. But we know as providers that that is just a state of mind that we can overcome 100%. And being able to give them those tools, being able to give them that understanding, it's what's going to make them be more likely to reach out and get the help that they need so we can save lives, as the title of this lecture entails.
Yeah, thank you. What do you think we can do personally? So I'm here on this end and I'm listening to this and I think, okay, yes, I know people that might have needed help at a certain point or in life, right? Because they were depressed or something happened. And like you said, I come from a Hispanic family, and so there is taboo around these things. It's like, no, I'm okay. I'm going to be fine. It'll go within time. So, and I'm sure there's a lot of people in my situation that we've encountered this at some point in time. How do we go about, is it about informing them? Is it about, putting on a program? Is it about taking them to a doctor? Because if I said to a friend, for example, I'm just going to take you to see a therapist, it'll be like, no, right? I don't want to do that. So how do we take that first step within among our community to make those little changes?
I think that one of the first steps that we can take in order to move closer to the place where we feel more comfortable talking about mental health is just providing resources. Um, One of the most difficult things or one of the most difficult areas to get help is mental health. There's not a whole lot of providers. There's not a lot of mental health providers that you can say, um, I'm going to go talk to my psychiatrist and he's a Spanish speaking person and I want to speak in Spanish. There's not a whole lot of opportunities to do that, let alone if you don't have a really good insurance, it becomes even more difficult. I think the first thing is anyone that believes that's having some sort of mental health issue should always get some sort of an assessment. It is very important for them to get assessed so that they can first identify what the problem is. That's always the first step. We need to identify if there's an issue. The problem, as I said, is the stigma. People are not willing to take that first step to talk to someone, to make an appointment. Um, we need to normalize mental health the same way that we normalize high blood pressure, the same way that we normalize diabetes or arthritis, right? We need to normalize. If you have depression, there's some chemicals in your brain that are not balanced. Let's get you those chemicals. Let's get you those SSRIs. Those are a type of medication that we give for patients that have depression. And so within our communities, what can we do? One of the things that I think is important for us to know is anytime that you notice that there is a significant change in a patient's behavior, that is a cause of concern. That's where you want to obviously get in there and try to provide resources. If you know somebody that was usually cheerful and used to go out and hang out with you guys, but then all of a sudden you see a significant change in the person's personality and behavior, that's a telltale sign that there's something that may be going on, even if they're not talking about it. And so that's where we could come in as family members and try to get them some help. Just trying to get them an assessment. Talk to a psychiatrist. Talk to a psychologist. Very different fields. I get those two things mixed up all the time. Not myself, but I mean a lot of people when they hear that I'm in the world of psychiatry, they say, "Oh, you're a psychologist." It's like totally different.
We'll need to start explaining that one too. So we were talking about mental health, and you've mentioned a couple of times also, like, diabetes and all. So my thoughts are also within this mindset of, and I think I brought it up yesterday, of, someone, especially with men, I think culturally, right, it happens that you get sick and you feel that, oh, I'm strong enough, I'm going to brush this off, I'm going to be okay, right? Because you're the man of the house, you're the head of the house. Now, I know that's changed, I think, a bit more within the generations, but we still have a lot of generations that have this idea. And I think specifically when we think of, rural areas and people and the family member that has to provide. So what do you think we can do there, or what's happening there? Have you seen a change in that mindset?
That's a great question. So you're very correct. There's a stigma as well, especially amongst minorities like Blacks and Latinos, where we have that particularly men, they have that mentality that as providers, they don't have time to get a physical, they don't have time to talk to a provider, they don't have time to make an appointment. I think that what we need to do collectively is we need to reframe the question. Because you are the provider, because you are the pillar of the house, that's the reason why you need to be in tip-top shape. You need to make sure that you're doing well. You need to make sure that you're healthy so you can continue to do the things that you so proudly are doing, right? I can give you an example. I used to do home health, where I used to visit my patients at home, and I used to do a quick head-to-toe assessment, and I used to trying to make sure that the patients do not get hospitalized. Really, that was the goal. We make sure that if they have any issues with diabetes, for example, which was very common, I will teach them eating plans. I will teach them exercise plans depending on their level, the level of activities. And I remember there was this one specific patient. He was from Mexico, older guy. He was 68 years old. and he had not seen a doctor. He had not been to a visit for 3 years at 68 years old, for 3 years. And he had diabetes and hypertension. And he said, oh, I know when my diabetes is high, I know what to do. I know when my hypertension is high, I know what to do. So when I took care of him, doing my head to toe assessment, I uncovered that one of his toes was becoming gangrenous. Basically, one of his toes had a small cut, it became infected, and now it was basically rotting away. And if I had not detected that, probably the patient would have had to gone through an amputation, something that happens very commonly in diabetes. If you get an infection because of how slow um, the healing process is and how compromised your vascularity is, it becomes very difficult for them to heal those types of wounds. And after that, he was just very grateful. He was just very appreciative to the fact that we were able to take care of that in a way that was not catastrophic, right? And that's what I'm talking about. We need to provide those types of resources. If you don't come to healthcare because of whatever barriers you have, we should be able to have programs in place to provide those services to patients. I do a lot of times. I talk to my patients through Zoom. I don't need to see you in person to do a mental health evaluation. We can talk through Zoom. It's convenient to the patient. They don't need to cancel. They can do it from work. They can just take a lunch break and talk to me for 30 minutes. And we can modify their medications. I can submit a script if needed, right? And those are the kind of resources that would enhance the participation of the minorities, especially those minority men that have that stigma of being the provider at home, to be more engaged in their health.
Absolutely. Absolutely. Thank you. Do you think, so you mentioned Blacks and Hispanics, right, as the minorities that may need more help with this. Are there other minorities that you would say that fit into that same category where they need more help within the communities?
Oh, absolutely. I can tell you that different populations have different um, chances of developing specific issues.
Right.
For Hispanics, we're more likely to develop just because of being Hispanics, right? We're more likely. Doesn't mean that we're going to. There's,
Right.
For example, diabetes is 100%. Diabetes type 2, it's 100% preventable. Anytime that you hear somebody saying, "Oh, I have diabetes because my parents had diabetes," that's not necessarily true. It is true that you're more likely because your parents had it, but if you do things differently, you can 100% avoid diabetes. And diabetes is somewhat reversible as well. So it's not something that once you have it, you're always going to have it and there's nothing you can do. But that's a topic for another time. But obviously, there's other minorities within our community that definitely have other sort of issues. For example, the Asian community, they're normally known for having things like cardiac problems, right? And that's something that they also should be educated on, so that they are more in tune with those sort of issues. I know the Indian community as well have they're usually have issues with high blood pressure, for example, right? And so knowing we have this information, right? So we know where our people are. If I'm talking to somebody of an Indian descent, I'm gonna tell them, hey, just because you are where you're from where you're from, that makes you more likely to experience these types of issues. And then I can do some sort of education. These are the things to look forward to. These are the things that you can avoid. And please make sure that you do your regular checkups. And so we have the information. All we need to do is be very intentional with it.
Right. Right. Thank you. And I asked that question because it's really about not just us, it's about all the communities, and it's about knowledge and preventive care, it sounds like, right?
Yes, and I forgot one community, even though it's not a minority, but the white community. We know that males after the age of 65 have an uptick on depressions. White males specifically, they have a disproportionate number of patients of that community that deal with depression and suicidality. That is something that we also know. We also know that in the Caucasian community, in the white community, they have a lot of issues with congestive heart failure and cardiac problems. So again, just knowing and being intentional with our education and our resources, it will definitely be able to help not just minorities, but the country and the communities as a whole.
Having the communication, and it goes back to your topic, diversity, right? If we have a way to speak to our population before it happens, that's even better, right? Because we're preventing it.
We're trying to move from a reactionary healthcare system to a healthcare system that is about prevention. It's a healthcare system that is about things not happening at all. And so our healthcare system right now, as it stands, it's a lot about what we call tertiary interventions. So tertiary interventions are interventions that you do once the problem already happens. We're trying to move to primary interventions, where we do things to try to make things not happen at all. Things like nutrition, things like physical activity, things like sleep, things like stress management. All of those things that we sometimes take for granted and do not really relate it to health. That's really what healthcare is trying to become. And that's what we're pushing as providers to see if we can get to the point where we are talking and having conversations today that's going to prevent a diabetes or a hypertension in the future.
You mentioned something very important, that's exercise, right? The physical activity. And something that is top of mind for me is, and I hear it in meetings that I have, even with coworkers, right? That because the community isn't used to having to go out, right? They work, really long shift. They go home, they want to be with their family, have a meal, and then go to sleep. There's not that mindset that you can make some time for exercise. And it seems that nowadays there's a lot of emphasis in physical activity to keep your health, right? To make sure you're healthy. What would you say right now to our community and the importance of having that healthy lifestyle, food, making and still eating the things that we like to eat, and exercise, which seems to be like the #1 priority?
Oh man, we can be here for hours talking about this because this is one of my favorite topics. If anybody here, anybody that knows me knows that I've been talking about eating habits and just overall healthy lifestyles for over a decade now. I can't really talk about exercise without first talking a little bit about nutrition. One of the nutrition represents 90% of health. If you're gonna be a healthy person, you cannot not have nutrition on board because it's the biggest, most significant, impactful thing that you can do in your life. Reducing simple sugars, making sure that those processed carbs are kept to a minimum, making sure that you're ingesting lean proteins, making sure that you're eating enough vegetables, making sure that you're hydrating, not drinking a lot of water. Drinking a lot of water and hydrating is not the same thing. If you drink a lot of water and it doesn't have electrolytes, it can actually have the opposite effect. That's one thing. Again, I digress. And so you have to know, you have to try and make the effort to learn about nutrition and to incorporate that. The second most important thing, I wouldn't even say exercise. I think the second most important thing for health is actually sleep.
Mm.
But sleep has a lot to do with many other factors, with your mental health. Are you anxious? Are you coping with stress well? If you're not coping with stress very well, you're not going to be able to have restful sleep. Because anytime that without the period of rebuilding, without the period of fixing things, you're not going to be able to thrive. You're just surviving. Surviving and thriving are two very different things. And sleep allows you to thrive. Then I will get into the exercise world. We now know that inactivity, it's much more dangerous than smoking. One of the things that kills people the most is muscle wasting. Incredibly, people that are just sitting for long hours, patients that are not doing a whole lot of physical activity, we do know that their muscles, they basically become atrophiated. And with that comes a lot of different chronic illnesses. And also, you're not going to have the strength to be able to overcome some of the common illnesses. If you get a flu, or even if you get the coronavirus, if you have a body that's not necessarily prepared to battle this bugs, it's going to be significantly more difficult for them to be able to overcome it.
Wow. Thank you for that. See, I had my priorities wrong.
Nutrition is by far the most impactful thing that we can definitely do. I would say sleep is second.
Yeah.
I'll say third is exercise, and fourth would be stress management, of course.
Wow. Very, very important. Well, thank you.
In my humble opinion, of course.
No, but thank you. See, we're here to learn. Thank you so much. So with our topic, what I want you to kind of bulk it all up and summarize it, and really, why do we have to pay so much attention to diversity in our healthcare system, and what can we do just as the general population to make those changes?
So the number one thing I would say is just get involved. Make sure that you are able to reach out and have an impact, and that impact can be in any form or fashion. What do I mean by that? Make sure that you are engaged in your school boards. Make sure that you're engaged in your local elections. Make sure that you're just engaged in your community, because our leaders are the ones that make or break um, the likelihood of us having access to things. Also, encourage all of our youth to just get involved in school, making sure that they are educating them about healthcare and how important it is for different points of view to mesh in the hospital setting, in the healthcare setting. Ultimately, we now know for sure that diversity yields positive outcomes. So it is incumbent upon ourselves to be able to demand that, to be able to make sure that we put in programs forward that will create a bigger pool of diverse populations to come into the healthcare system. It's not going to happen by osmosis. It's going to happen by us being engaged. It's going to happen by us demanding to get those services in place. And before I go, I just want to say I really wasn't going to talk about this, but something that I'm doing personally. I just created a foundation. My father passed away last May.
I'm sorry.
It's okay. He passed away May 29th of 2020, and I created a foundation um, with his name on it. The foundation is called Diomedes Galvan Napoles Foundation. Napoles was his nickname. And what I'm trying to do with this foundation is I'm trying to um, give the youth better opportunities. I'm trying to create recreational and educational activities that can give better opportunities to our youth. That's where the most bang for our buck is going to come from. Just giving them the supplies that they need to be able to go to school, paying for scholarships if necessary, um, helping with tuition, helping with food, helping with transportation. That's what the foundation is all about. I just put it together. It's 501c3 certified, so any donation is going to be it's tax deductible. We're working now on creating a website and starting to get the word out. We're very early in the work, but it's something that I'm very passionate about, and it's something that we're definitely going to make happen.
Thank you so much for sharing that. And definitely, when you have everything, everything ready, the website, please share it with us. We'd be more than happy to share it with the community.
I
Definitely,
will.
we would want to participate in. Rafael, I don't know if you're there, if you have
Yes,
a question.
we have a couple of minutes for questions. The first one, it's at which point of your journey did you realize or think that you will have continued this far?
At no point. If I don't stop to I I sometimes have to pinch myself because I've given speeches to generals and admirals in the military. I've done lectures for psychiatrists and medical directors. I've done things that I would have never thought I would because of healthcare. At no point I thought I would be doing the things that I'm doing. And I still don't know where this journey is going to take me. I don't really have any, like I don't, my north is do the best that I can and always try to better myself so that I can pave the way for other people. But what is that gonna amount to? What is that gonna translate to? I don't know, and I just can't wait to find out.
Sure. Thank you for sharing that. We have another comment. Bravo, Lieutenant Galvan. Thank you for your leadership and commitment to the youth. Your father will be very proud of you. And we would like to invite the audience, if they have questions, please, raise the hand and type the question out so we can deliver the questions.
Thank you, Rafael. So while we wait for a couple of questions, what are your next plans? Do you have any next plans?
Well, once I finish my degree in December, I want to put a lot of effort into my my foundation. The foundation is it's both in the United States and in the Dominican Republic, and so I'm trying to see. I love philanthropy. I think that's where my heart is now. That's what motivates me. I just want to. I have so many things that I want to do. I want to recruit providers to come over here and provide services in the Dominican Republic. I want providers to go out there in the community and go into the homes of low-income families and just do quick screenings so that they know whether there's some issues that they may be having, they may be brewing, so that they can get some help. Yeah, I just want to be able to call out on the strength of healthcare and for people to respond. And so that's really my mission right now.
That's a wonderful mission. I'm sure you're going to achieve it. You've been achieving a lot of things along the way, so I'm sure we're going to hear about it very soon.
You're very generous. I appreciate it.
All right, no more questions, Emily?
No, we're okay.
Oh, we have one more. I'm sorry. We have one more. What's the plan to begin normalization or mental disorders in our Hispanic community?
I'm sorry, can you repeat that?
What's the plan to begin normalization of mental disorders and our Hispanic community?
I think the first thing that we need to do about that is just educating the public. One of the things that I actually want to do through the foundation is educating the kids about it, educating those teenagers so that they can go home and talk to their parents about those kinds of things. Think about it, if my kid came home and we started having a conversation about depression or about suicidality or substance abuse, which is another hot topic, right? Those are things that I'm having a conversation within the confines of my home. And so education is paramount. How do we disseminate that education? It has different forms. It has to be through our leaders in the local communities, government, and our educators. We just need to create those programs that are very, very intentional on achieving that, making sure that we're reaching out to the people where the people are, as opposed to just creating websites. I mean, that's good, but it's just not enough. Not enough people are going to be reaching into these resources. So we need to make it very, very available to the community we're trying to reach out to.
Thank you. Rafael,
no more questions, Emily.
We're good. Okay. Lieutenant Galvan, it is a pleasure. Muchísimas gracias por estar con nosotros. This has been a very insightful conversation, and I hope that you can join us at some point along the way, and we wish you all the best in this journey and in all your projects.
Muchas gracias, Emily. Quiero agradecerte por las preguntas que me has hecho. Han sido muy, muy interesantes y han hecho que yo hable de muchas cosas que ni siquiera tenía planeado hablar de ellas, pero realmente me siento afortunado de que me haya hecho esas preguntas. Y por último, quiero agradecer a todas las personas que tomaron un poquito de su tiempo para estar aquí escuchándonos, teniendo esta conversación, y gracias también por las preguntas que me hicieron. Espero que algún día pueda yo, de alguna forma, tratar de ser parte de la persona que pueda ayudar a nuestra comunidad y al público en general. Y quería también compartir ya de último una pequeña historia para que la gente vea qué tan conectados estamos. El año pasado, cuando mi papá estuvo enfermo y lo llevaron a la sala de emergencias, no podían haber visitantes, las personas no podían entrar con visitas. Y mi papá tenía mucho miedo porque estaba bastante enfermo y estaba en un ambiente desconocido. Cuando me dijeron en qué hospital estaba, yo me entré a mis redes sociales, al LinkedIn, y vi que yo tenía estudiantes que trabajaban en ese hospital. Estudiantes que yo había trabajado con ellos y que yo había estudiado y que yo había ayudado a problemas que ellos habían tenido de forma personal. Y ellos estuvieron ahí con él. Ellos me hacían videollamadas, ellos se preocuparon por él, ellos se comunicaron con él y eso me hizo sentir tan, pero tan agradecido de que yo en su momento, cuando yo pude extender la mano y ayudar a mis estudiantes, ahora ellos tienen la oportunidad de hacer algo por mí. Y esa es la conexión que existe dentro de la salud, dentro de nuestra comunidad. Y eso es a lo que yo me refiero de que ayudarnos unos a los otros para que en cualquier momento alguien te ayude a ti de la misma forma que tú los ayudaste a ellos. Gracias a todos por su tiempo.
A usted, gracias por compartir la historia. Muchas gracias. Everyone who joined us, thank you very much. And we will see you next month for our following lecture series. Thank you and bye.
Bye.